And so I'm Emma Cunningham. I'm a clinical academic, which means I work half my time in Queen's University as a researcher and the other half of my time as a consultant geriatrician in the Belfast Trust. So in terms of delirium prevalence, really you need two things to have a delirium. You need a brain and an insult. And prevalence is high where brains are vulnerable and insults are severe. So if you think about brains are vulnerable at the extremes of life, so delirium is common, or is relatively common in younger ages. And the bit that I know more about is also delirium is relatively common at older age. And obviously brains are old for a lot longer than they're young. And so there's a lot of delirium in older people. And also delirium is more common where brains are made vulnerable, not just by age, but by neurodegeneration. So where people have dementia, so where neurodegeneration has progressed to the point that it's manifesting as cognitive symptoms, then delirium is common there. So if you think about the areas of healthcare where you see a lot of older people, or a lot of older people with dementia especially, so nursing homes, delirium is very common. Stroke wards, delirium is common. Geriatric inpatient wards, acute medical wards, emergency departments. Those are the kinds of places where you can often see delirium being common because of because of how many people with vulnerable brains are there, or hip fracture, so that's another very common area. And that's because, so delirium is common in hip fracture populations because brains are vulnerable, but also because of the insults. So if you think about, there's a wide range of insults that can precipitate a delirium. If someone has a very vulnerable brain, then something seemingly minor like a urinary tract infection could be enough to precipitate a delirium. If people have young, robust, big juicy brains, then you probably need quite a significant insult often to precipitate a delirium. So if someone's very unfortunate to have a road traffic accident and end up in ICU, to be on lots of medications, to have lots of facets to their illness, you know, it's not surprising someone becomes delirious. And then that can be where the environmental factors come in too. So with the best will in the world, you know, a lot of the acute healthcare settings have what you would consider kind of deliriogenic environmental factors at play. So it's often noisy at night, it's often bright at night. People can't settle at night and get their sleep the way they might. And then in terms of, if you take, so not just the environmental factors then, but think about, again, coming back to the precipitants. So we've said trauma, illness, infection, surgery is a very common precipitant. And again, cardiac surgery in particular, it's a very common setting for people to develop delirium because it's quite a big insult, cardiac surgery. Again, with all the best will in the world and all the best measures being taken, you know, these things are still insulting to people's bodies. In the case of cardiac surgery, the reason that people are requiring their heart surgery, so for argument's sake, someone has cardiac, or oh my goodness, coronary artery disease, and they might well have cerebral artery disease too. So think about, when you're trying to think about where delirium is, you're going to see delirium, think about where brains are vulnerable and where insults are significant.